Lecture halls, classrooms, and dormitories all require students to be in close and constant contact with one another, giving the flu a way to be readily passed around.
I was sitting in one of my lecture halls, and the kid next to me was coughing and sneezing a lot, and then a couple days later I got really sick, and so I decided to go to Wardenburg, and I realized I had the flu.
The CDC recently reported that this flu season is one of the worst in decades, with almost 30,000 confirmed cases in the U.S. alone. Over 10% of the sick students that the campus clinic has seen since October tested positive for the influenza virus. The campus clinic, known as Wardenburg Health Center, is trying to stay on top of this flu season and keep the number of affected students to a minimum. Flu vaccinations started being distributed last semester.
So this year we've given out right around 2,700 from October up to the present.
But the media frenzy surrounding the flu in late December prompted students to seek out vaccines when they returned to campus.
I think there was one day in January that was completely crazy. I think we gave 250 of those shots in one day, a full 10% of what the total number that we gave in one day.
CU is well aware of the dangers surrounding close quarters like dormitories. Every dorm on campus has a policy set in place in order to contain the disease if it starts to affect residents.
You pretty much just tell them not to go to class, not to interact with anybody else on the floor, kind of just stay in their room, pretty much to tell them to quarantine themselves.
These policies are effective because it keeps sick students away from large gathering areas like dining halls and common rooms. In addition to the quarantine method, the dorms have other ways they are trying to keep their residents healthy.
There's been a big campaign around for environmental services staff and everybody else to be doing extra disinfecting for all common spaces. So even handrails on all the stairwells and doorknobs, those areas that get touched often.
All of the policies that CU dorms are implementing should help prevent the spread of the flu among those dorm-dwelling students and staff. According to the Fair and Hall director, the amount of cases of the flu on campus seem to be accelerating in recent weeks. Not touching surfaces after or before touching your own face, mouth, or nose, and carefully washing your hands on a regular basis are both good ways to stay healthy. These suggestions can also be found on the clinic's website at www.colorado.edu/healthcenter/fluinfo. In order to appropriately protect yourself and others around you, the campus urges students to adhere to the suggestions from the Wardenburg Clinic and get the flu vaccine. Emma England, News Team Boulder.